Vanessa Lopez. I'm a student physical therapist. May I please have your name and date of birth, please?
My name is Nelson Lopez. I was born on February 27, 1955.
Very nice to meet you, Nelson. So today we're going to go through a cardiovascular examination. And to begin, we're going to start with your past medical history. So have you had any prior cardiac events?
No, I have not.
Okay. And your risk factors that I see here from your medical history. I see that you have some diabetes, type 2. You are at the age of 65, and you have some hypertension. And through your family history, I see that you have some cardiovascular history. If you can go ahead and explain that to me briefly.
My mother has hypertension. She's had a few heart attacks, and she has a pacemaker with a defibrillator for the last 15 years.
Okay. Describe to me your symptoms now.
Well, I have some real heavy crushing pains in my chest down this way, and it goes to my left arm.
Okay. When do you notice that? What time of the day?
I run a lot, I walk a lot, and I sometimes sprint, and when I'm going up the hill, I start to get a crushing feeling. And when I'm playing with my grandson, I feel myself getting fatigued and tired.
Okay. How long does that last, and what do you usually do to make it go away?
Well, when I'm exercising, I stop running, slow down, and when I'm playing with my grandson, I slow down also.
Okay. Any more associated symptoms that you get during that time?
I feel real fatigue. Sometimes I feel like I'm short of breath.
Okay.
I feel like I got just very weak.
Okay. And how long do you usually have those symptoms for?
It can be anywhere from 2 to 10 minutes.
All right.
Sometimes a little more, but more about 10 minutes, I get to normal.
And other than those heavy times, you do not feel those symptoms throughout the day at all?
It's not programmed throughout the day, but it's, anytime I exhaust myself,
Okay.
anytime I get tired,
Okay.
anytime I'm doing exercise or yard work.
Okay. All right, Nelson, before we continue with our examination, are you comfortable being in the seated position the remaining of the time?
Yes, I am.
Okay. And would you like me to grab you a gown for draping, or are you comfortable with being without your
I'm
shirt?
very comfortable. Thank you so much.
Okay, great. This portion of the examination, Nelson, I'm going to complete some observations, and I'm going to palpate specific areas on your chest and your extremities. Do I have your consent to do so?
Yes.
Okay.
I'm looking for efforts of the patient in breathing. Are they in distress or fatigue? Evaluating their neck for muscles or jugular vein distress. Also the patient's posture or their nail bed.
Very good. Bring it down.
Palpating areas of the chest wall, such as the sternum and the trachea, are important for differentiating between the musculoskeletal pain or cardiopulmonary system related. Also doing this while the patient is inhaling and exhaling to determine if it's the origin of the skeletal muscle or cardiac related.
No discomfort in any of these areas?
Nope.
Very good. And now I would like to begin taking some vital signs, and we're going to start with your pulse, okay?
Okay.
So if you can just have your arm by your side, please. Very good.
This patient presented with a rate of 68 beats per minute. Their rhythm was regular and their quality was normal. This signified that they had a normal grade of 3+.
Very good. That's my pressure, okay?
Okay.
Have you used the pressure before?
Yes, I have.
Okay.
The patient had a systolic value of 141 and a diastolic value of 86. putting him in the category of stage 1 hypertension.
Now that it's already heard, I'm going to go ahead and take your actual blood pressure, okay?
Okay.
I'm going to have to go over it one more time. Are you ready?
Yes.
Very good. Very good. Now I'm going to go ahead and listen to the sounds of your chest. With this stethoscope, I'm just going to go ahead and point the different directions on your chest at different times. Do I have your consent to do so?
Yes, you do.
Thank you.
Normal heart sounds were heard at the 4 points used for oscillation. The lub and the dub were heard at all 4 points without any noticeable abnormalities. The lub was naturally louder at the aortic and pulmonary area. As for the dub, they were heard stronger by the tricuspid and mitral areas by the apex of the heart.
Very good. And now I'm just going to go ahead and flip it over and utilize this side.
The stethoscope was turned, utilizing the bell portion to assess for any abnormal heart sounds, such as S3 and S4. For this particular patient, nothing abnormal was heard.
Very good. Now let's complete.
The final component is incorporating an outcome measure, such as the Canadian Cardiovascular Society Functional Classification of Angina, which is used here.
During ordinary activity causing mild limitations, during low activity causing marked restrictions, or would you say that these symptoms occur when you're at rest?
Most of the time when I'm doing strenuous activities.
So mild limited with ordinary activities. So as you mentioned, going up that hill when you're walking during exercising, or playing with your grandkids.
Based on the
outside.
patient's answer, this would mark him in class 2.
Doing up the stairs, just
Okay.
walking.
Yes, sir. Okay, thank you.
If stable angina was your diagnosis, then you are correct. This patient's vitals need to be re-examined during stressful metabolic demanding activities. This can be done during exercise stress testing. Placing an electrocardiogram on the patient during the stress test will determine if the myocardial oxygen demand affects the conduction of the heart. In stable angina, ST segments or T-wave inversion can be seen. And finally, hemodynamic changes will indicate any ischemia to the heart. Thank you so much for watching.